Good afternoon, good morning, or good evening, if some of you are joining from different time zones. Welcome to the second webinar on how we can use our voices to reach a wider community for antimicrobial resistance, or AMR, which aims to highlight and discuss concrete examples of patient and community engagement and mobilization. This webinar is the second of a series of 3 webinars organized jointly by the European Patients Forum and the AMR Narrative. I am Vanessa Carter, an Executive Director of the AMR Narrative, and also currently serving as a chair of the WHO Task Force of AMR Survivors. And I'm also an AMR patient survivor myself. And I'm also here with Francesca Chiara, who is also serving as the chair of the board of trustees of the AMR Narrative, who will be moderating our panel later in the discussion today, and Claudia Leotti, who is the head of policy at the European Patients Forum. So I'm now going to hand over to Claudia.
Thank you very much, Vanessa, and hello, everybody. Welcome to this webinar. This is a joint webinar series, and we're very happy to partner with the AMR Narrative on this important initiative to highlight the impacts of AMR on patients and emphasize the importance of patient participation and community engagement as we push for more action on AMR. Patients spend significant time in healthcare facilities. Many routine care procedures require antibiotics, and therefore they are particularly vulnerable to AMR. In view of the rise in healthcare-associated infections and resistant bacteria, patients can face harder to treat infections as well as less effective treatment options, and this can result in longer hospital stays, more severe outcomes, increased mortality, and significant impacts on patients' health and trust in the healthcare system. So ultimately, AMR threatens access to safe care. There is a need for increased awareness and increased action to address this threat. And the objective of this series is therefore to provide a platform for dialogue and connection among the patient community to foster advocacy efforts. We want to create a space for diverse groups of patients to share their stories and connect with each other to engage in AMR advocacy. We also want to bring in experts who are directly involved in current debates on AMR to hear their thoughts on how to mobilize communities and give patients a voice in this important field. So we had a first webinar in June that helped us bring to light the impacts of AMR on various patient communities, as well as start identifying some opportunities and challenges towards improving advocacy and understanding of AMR. This webinar is available on our websites, so don't hesitate to rewatch them if you haven't. And the second webinar today with our very impressive speakers and panelists will allow us to further the discussion on ways to support patient advocacy and highlight concrete examples of patient and community engagement and mobilization. So the agenda today, so we've started with some welcome remarks and introduction. Then we will have Pernilla Rönnholm, who will give her patient survivor story and also share some tips on advocacy from her experience in becoming an active advocate on this topic. Then we will have a panel discussion on how to create a ripple effect in our communities for AMR. And then finally, some questions and answers and closing remarks. So please do not hesitate to drop any questions you might have for our speakers in the Q&A, and we'll be happy to take them later in the discussion.
Thank you so much, Claudia. So just a couple of housekeeping rules, the norm when it comes to webinars, let's keep it productive and respectful. Please mute yourselves when you're not speaking. Use a headset or earphones if you have any. Use the chat box in case of technical issues, and please use the Q&A, as Claudia said, if you would like to ask a question. So you'll see there's 2 separate boxes. We've got the chat. And maybe what you can do in the chat box is also tell us about who you are and where you come from. And again, in the Q&A, ask us questions. So we can go to the next slide. So to start off with, we're just going to introduce ourselves. We're going to talk a little bit about what the AMR narrative does. We are a newly formed charity. I've been a patient advocate for the last 11 years, but after moving to the UK, we registered this charity with some very amazing trustees that had the vision of what we are trying to do in terms of working with patients and the public. So we are a charitable incorporated organization working globally, and again, founded by an AMR patient, survivor, and advocate. We are currently have 7 founding trustees and 10 independent voluntary advisors. Why do we do this work? We recognize the need to establish a patient public-centered charity that focused solely on AMR, so this work was continuous. There aren't many charities that solely focus on AMR, and this is what our strategic objectives are about. Our 3 pillars focus on developing patient and public advocacy, promoting an understanding of AMR, and fostering a global community. AMR is global after all. As you can hear by my accent, I come from South Africa. I'll always be proudly South African. I live in the UK now, but AMR can cross borders. None of us are safe from these resistant infections crossing borders. So this is why our vision was to create a charity that built a global community, again, focusing mainly on patients and the public. We advocate from a One Health perspective. In other words, it's not just talking about human health, but also how animals, how resistant infections can cross between animals, food, agriculture, and environmental sectors. So, for example, we do know that infections can be picked up from, food, not, for example, washing your hands properly when you're preparing food. Salmonella is a very good example of that. And so we wanted to take that perspective because it's not just about patients, but it's also about consumers. When we talk about the public, it's about patients and consumers. AMR is a diverse and complex problem that requires the involvement of different stakeholders. And part of our vision is to help patients and the public engage in this global challenge, not only through storytelling, but meaningful participation. So one of the focuses that we have is trying to encourage meaningful mechanisms to help patients that might not, for example, be able to fly to events. There might be other ways that they can tell their stories, and that might be through, online platforms like this, where they have health conditions and so on, or they don't have financial means to be able to share their story. So this is a very big strategic objective of ours. And in fact, our slogan is Voices Together for Antimicrobial Resistance. So, one voice is powerful, but all our voices together are even more meaningful. So I'll hand back over to the European Patients Forum now to present their slide.
Yes, just a few words about EPF. So we are an independent, non-governmental umbrella organization of patient organizations across Europe. We were founded in 2003. And we have 79 member organizations that are either national coalitions of patients or are EU disease-specific organizations. And we are across diseases and across EU. So our vision is a Europe where patient organizations are valued partners in creating equitable, person-centered, accessible, and sustainable healthcare systems based on patients' unique expertise. We very much focus on ensuring that patients have a voice, that they can participate in health policy and in their care more generally, and in the building of more equitable healthcare systems. And our mission is to advance the interests of patients and patients' communities by strengthening the collective impact across Europe. And we do that through various ways, including advocacy. Of course, we're very active in policy debates at EU level and also helping our members engage at national level, education and capacity building, empowerment, and of course, partnership. I think we can move to the next slide. Thank you.
Yeah, we obviously found this partnership really meaningful because, especially after getting through the first webinar, we realized that patient voices are so key. and a lot of patient advocates are arising, through our own experience. So I think that one of the first things is, as we said, like sharing patient stories, survival stories is so key. And this is not just in terms of bringing a human face to AMR, but also enabling policymakers to realize, the potential of the policies that they're making, behind the statistics and so on. So I want to introduce Pernilla Ronholm, who has been a stalwart of change in terms of patient advocacy. She worked for 35 years with the Swedish NHS and now working with a pharmaceutical company. In 2011, Pernilla gave birth to 2 twin girls 3 months prematurely. During the birth, Klebsiella pneumonia was transmitted, which led to sepsis. At 8 days old, one of the girls passed away. In 2013, she established a non-profit organization called Premature Miracle, and since then, she has also advocated the importance of raising awareness of AMR, supporting families, and NRCU in innovative ways like donating funeral clothes made by donating wedding dresses to babies born during week 12 to 40. She is incredible as an advocate, and I couldn't be more honored to introduce her and for her to tell her story today. Thank you, Pernilla.
Thank you, Vanessa. Really appreciate being here and being allowed to share my story and share some knowledge about what it is like to face AMR, really on a personal level. So thank you very much, Vanessa. My story really began, as you mentioned, Vanessa. I was pregnant with twins, and what I didn't understand was that I had a lot of pre-labor, a lot of complications. I went to the hospital and said something doesn't feel right. They said that there was no problem. And last time I went to the hospital with labor pains was that a few days later, the water broke at week 25. And I was admitted to the hospital, a special unit where women with complications are basically bedridden and not allowed to move, just lying in bed and resting. And I was given antibiotics, as you can see here on the picture, for 2 whole days. They said I had an infection. What kind of infection, they didn't know, but it was an infection. So I was bedridden for 3 weeks with lots of different complications. I thought I was giving birth more or less every second day, but after 3 weeks, I gave birth to 2 girls at week 28. And considering being so early, they were pretty healthy. They only needed CPAP. And yeah, they were doing okay. And after 4 days, I got a phone call telling that Kirsty, who was born last, was ill. They didn't know what it was, but she was, they could tell that she was under stress. And a few hours later, they called and told that Freya, who was born first, also was sick. For many days, we didn't know what exactly it was. They were under stress. There was some infection. I wasn't given much information. And they were giving antibiotics. So Kirsty, she got worse and worse. And we still didn't really know what exactly it was. But day 5, we were tested. all of the parents, because it was a big hall with maybe 10, 15 premature babies in one place. So all the parents and all the children were tested to see what kind of infection it was. And I asked how long time will it take to get an answer? Because I have previously been working within CDC, and I'm pretty familiar with different infections and what it entails. That was then I understood that this is serious, and I was told it was going to take 5 days. And for some reason, I just realized, I just felt that this is not looking good. 5 days, it's not going to turn out well. So in the meantime, they were in the incubators, and Kirsty got worse and worse. Next slide, please. And in the end, Kirsty was, we were told that she was not going to make it, because both of my daughters ended up with sepsis, and Kirsty didn't make it. So we had to turn off the life support machine when she was 8 days old. This is the picture from the day before. They had a emergency christening, and we were not allowed to touch her because she was in so much pain, because when you have sepsis, it's really painful. So the whole body was infected with sepsis apart from the brain. And so she was taken out from the incubator, and I put her on my chest, and I sang Twinkle, Twinkle, Little Star for her when she passed away. This is her tiny feet. I took them when she had died to have as a memory. And this is not what many people would like to see and know about it, but this is what many families, especially in the neonatal care unit, is going through. So next slide, please. And here is me the day after Kirsty had died, and I'm doing called kangaroo care with Freya, who survived. And it's kind of a nightmare when you have twins, and one have passed away and the other has survived, and you are trying to focusing on the survivor at the same time as planning a funeral. So it's mentally extremely hard, and many hospitals don't really have this plan how to approach parents who have lost one child and are still in the neonatal care unit. So this is Kirsty's funeral when she passed away. Just before her funeral, I was told that the doctor who had asked me to turn off the life support machine for Kirsty, that they had been treated differently. So Kirsty died because she got 2 different sort of antibiotics, while Freya, she got 4 different kind of antibiotics with broad spectrum. So that's the reason why Kirsty died. So it's next slide, please. This is Freya. As we call it, angel parents, as or invincible twin parents. No one can see that you have twins, but you always know that you have twins. And this is kind of a way of looking at it. Freya looking at herself in the mirror, and remember taking the picture that it could have been Kirsty who was there as well. So when you have gone through something like this, a trauma, a huge trauma, not only giving birth 3 months early, but also losing a child. Of course, I ended up with PTSD, and you are stuck at home because Freya was really not allowed to go out because she was so sick, and had to avoid her getting any infections. So the social life is absolutely zero. You're just staying at home. You can't take the tram, the bus, the train, anything. You are stuck at home taking care of a child 24/7. So you are mentally really in a hard place. And Freya came home just before Christmas, so we spent Christmas all on our own, no relatives, nothing, no friends. And with PTSD, as many people know, it takes quite a long time to get well from that, and especially you need the support. At the time when I was going through this, there were no support for parents with PTSD. And there were no support for parents who had given premature birth when you came home from the hospital. So this is what I call life before and after Kirsty died, and it's certainly different in many ways. Next slide, please. So I decided that as a person, I'm kind of a problem solver. I can't see when things are not the way they should be, or that things can be improved, to just look at it, and I want to do something about it and make sure that no one else has to go through the same thing I did, to help other families, and also prevention when it comes to AMR. Because I got, when my daughters were born, I transmitted the disease to my daughters, because I had the unknown infection, ESBL Klebsiella pneumoniae. So someone hadn't washed their hands after going to the toilet, serving me food. And so I decided to start my non-profit organization and turning my trauma into positive changes and helping others. And here's Freya a few years ago, happy and very feisty. And you can see a picture she made. I have been very transparent when it comes to Kirsty. We are saying cheers to her when we're celebrating birthdays, New Year, Christmas. We talk about her. So she is a big part of our lives. And here's a picture of her family. And on the side there, you can see Kirsty with the Gloria over her head. So it's a big part. She's a big part of our life. And you can see here things I've done since 2013. I've been debating a lot in media, trying to focus on the importance of having single rooms in neonatal care units to stop spreading. Because when there is an infection in the ward, it spreads really quickly, even if the health professionals are washing their hands, using hand sanitizers, etc. But with single rooms, you can stop the infection really quickly, and not so many children will get sick. And I've offered tactile massage to the women with complications at the ward where I was admitted, because you are under serious stress and you easily get a depression. Some are lying there for weeks and months. And that has really been a positive change for many of them. which also Gothenburg University made a survey about, and a report about it, that it really helps the women. And for every day the child isn't born, the lungs can grow, and there's an increased chance for the child to survive when it's prematurely born. And I am debating a lot in TV, pods, radio, and newspapers, and I've been speaking in EU Brussels, which was a huge honor, making a difference on a daily life as much as I can. Next slide, please. And here are some suggestions that I think that needs to be done to work on prevention. I'm not going to read everything, but it needs to be definitely higher up on the agenda in many countries, because when there's an election, has any of you seen AMR being up on the agenda when it's been discussed in media? I doubt it. It's not been enough. In Sweden, it's not been up on the agenda apart from when it's been discussed about animals. So keep on making a difference, and as I call it, the silent pandemic. The fight continues. And thank you very much for having me.
Yeah, thank you so much, Pernilla. I think we're going to move on to the panel discussion in a minute or two, but I just want to ask you one question very, very quickly. Because your story is so powerful, and I've known you for a while, and I've heard your story a few times, and I've always been so moved by it. I think one of the biggest questions for me is, have you found when you've shared your story, or do you believe that by sharing your story, it could make a difference to policy making and community engagement, and in what way?
Yes, I mean, I know that I have made a difference. I have been part of, I was one who have pushed that there are more single rooms in the neonatal care unit, and also showed the importance of support for parents who are leaving the neonatal care unit, regardless if you're losing a child or not. And also giving AMR a face, a voice, because still a lot of people don't know what AMR is. They have no clue, and people are more aware, and they're thanking me for making them cope with the time they're at the hospital, and showing that we all have a responsibility. We can't just push it to decision makers, but we all have a responsibility when washing our hands, cooking, going to the toilet, basic things. We are all we could all be part of the solution, not the problem.
Yeah, that's very, very true. And of course, patients are part of that as well. Patients and carers, are part of that problem. Yes. As long as we are informed and we educated and we know, what role we have to play, it's really, really important. So I think I just want to say thank you so much for sharing your personal experience. I know what it feels like to do that from a patient to a patient.
Yes.
So thank you very, very much for being here with us today.
Thank you.
Yeah. I guess the next part of this webinar is for me to hand over to our chair of the AMR Narrative, Francesca, who's going to moderate the panel discussion. So over to you, Francesca.
Thank you, Vanessa, and thank you, Pernilla, for sharing your story. It's very touching. Thank you. So we are joined today by a fantastic panel of professionals also leading work on AMR and trying to raise awareness about AMR in our communities. So our first speaker is Ana Navarro, who's a journalist by training, and she's been in charge of various communications projects on several European projects. She's also experienced in creating documentaries and awareness campaigns. And she's joined by her colleague, Laura Alonso, who's also a communication specialist who has worked with various United Nations agencies and NGOs. And both Anna and Laura are currently working at the European Joint Action on Antimicrobial Resistance, or EU-GMRI. Our next panelist is James Malar, who is a human rights lawyer who works for the Stop TB Partnership, where he leads the community engagement work and also human rights work. The third panelist of the day is Danilo Lopho Wang, fourth panelist is Danilo Lopho Wang, who has 30 years experience working on food safety and AMR, and since 2011 has been working as the regional advisor for AMR control at the World Health Organization office in Europe, in Copenhagen, where he coordinates AMR work across the various member states. And last but not least, we are also joined by Andrea Caputo Svensson, who is a global health advisor for REACT Europe and is the coordinator of Antibiotic Smart Sweden, and has recently launched a campaign called From People to Leaders, Acts on AMR Now, to foster a global community-driven movement to raise awareness on AMR in the lead up to the United Nations General Assembly in September. So in the interest of time, I'm going to start with questions immediately. And I'm going to ask the first question to James. So James, you represent a community of patients, TB patients, who are particularly vulnerable to AMR. So how do you raise awareness about AMR in your community?
Thanks so much for the question. And I'm also just acknowledging the previous speakers. I saw some of the comments, and I think there was just really powerful testimony there, and very touching. And in many ways, it's very difficult to follow such a compelling story. So just appreciate you taking the time, Pernilla, to share that. So look, from my side, I work with the Stop TB Partnership. It's the United Nations hosted partnership to NTB. And I wanted to just sort of pick up this question, but to sort of maybe focus a little bit around the upcoming UN high-level meeting on TB. I guess this is an important focal point for the AMR community and for TB, drug-resistant TB, whether multi-drug, extreme drug, XDR, TB are all such significant challenges as part of the TB response, as part of the AMR response, as part of the broader health response that many of their countries are facing globally. So a couple of things that I think were, of interest here and can potentially be useful. TB has been, a relatively small community and not had such a strong voice for many years, but are using the high-level meetings, both in 2018 and last year in 2023, we saw them as a really useful focal point to really mobilize communities, to mobilize governments, to mobilize private sector, all around sort of a common set of shared goals, of a shared vision, of shared targets. And this is something which I think from the side of AMR, there's a real big opportunity to do. I note the role that Vanessa and others are playing in terms of WHO's panel around AMR, and note that for one of the things for TB is we had a community advisory panel around the high-level meeting for TB, which was, its critical mandate was about ensuring that communities were informed about all of the steps leading up to, during, and after the high-level meeting, and had like a role to contribute in shaping agendas and priorities and key asks, and also had a seat at the table wherever possible. So this is something that's critically, I think, important. Having briefings that are led by community, by AMR survivors, by people affected by by AMR is something that's also important. And I note that currently today we're talking about this is in a global context, but it's equally important, you know, at the country level and at the subnational level, you know, having multi-stakeholder roundtables, bringing together government and different partners around this is something that's important. And having a shared set of priorities or key asks is certainly something that we've found from like the TB side has been really helpful for this. We've developed it for the TB high-level meeting, which had, you know, different stakeholders' input to really share what are our main priorities, what are the targets we want to see, what do we want to see different actors do, but then to make sure these discussions not only happened in New York, which was important, but happened on the ground at country level as well. Having communities and civil society as part of national government official delegations heading to the UN is important. Making sure that they're well briefed with your priorities and with your key asks is something that's certainly important as well. I think using this also as a moment where it's not just one day in time is of critical importance. And from the TB community, one of the things that's been done is having a community-led report for accountability, looking at the progress around the targets and commitments that countries will make this September in New York. What happens a year from now? What does that progress look like? And what do communities see as the priorities or the actions that really need to be taken to make sure that, you know, we don't just have leaders speaking very passionately for a few moments, but we keep coming back to these targets and make sure there is the progress, make sure that there is the investment that's needed, make sure that there is that political ambition that is needed to make that change. So I think that, you know, doubling that with some initiatives like community-led monitoring, investment in communities and civil society for advocacy are really, really key things to ensure that, you know, that this sort of change can take place. For TB, looking at September, there is a set of key asks from the TB, from MDR, TB community to sort of say, what do we really want to see in the AMR declaration? That's something that I can share in the chat. But I note that there are lots of good targets that already exist, lots of good commitments, and we need to make sure that we double down on those. But then we follow up with advocacy, with monitoring, and with accountability mechanisms that ensure that those targets and commitments can become a reality. I think I spoke for too long. I'm sorry, Francesca, back to you.
No, that's great. Thank you so much for sharing that. I think what you're saying, it's extremely important. And actually, I'm going to move to Andrea, because one of REACT's mission is to communicate about AMR and the complex nature of AMR in communities globally. And so I'm really interested to hear about the work on AMR in the lead up to ANGA in September, and as well as the challenges that you are facing in driving this agenda forward, but also some of the successes that you have seen, like some of the achievements you were able to see so far.
Thanks, Francesca, for the question, also acknowledging the speakers before, and really happy to be part of this panel. And thanks again for the organizer to inviting me and REACT to be able to give us our perspective on the topic that, as many of you know, REACT was created almost 20 years ago. So next year will be the 20th anniversary. And we are spread all over the world. I'm sitting in Uppsala, Sweden, where we do quite a lot of work also when it comes to policy, but I also need to acknowledge the other nodes which are sitting in the Southern Hemisphere. So in Ecuador, representing Latin America, Cuenca specifically, in Lusaka for our Afro region, and also in Asia Pacific, in India specifically, in the Kerala region. As you know, REACT has been one of the first international independent networks to articulate the complex nature of antibiotic resistance. And complexity is actually, I think, one of the challenges that over the years we've to communicate how AMR, for example, versus antibiotic resistance are communicated in relation to their respective data. So it's really important, and we've been trying to also give that narrative for many years in terms of referring to antimicrobial resistance as indeed resistant to antimicrobials, which are wider, and one of the antimicrobial is indeed antibiotics. So it's important to make this distinction also when we discuss about data. But definitely, as we are talking also about community, it's important that we take into account the diversity of the audience. And sometimes what it resonates, for example, with policymakers or health professional doesn't resonate with the general public. So it's important also to make sure that we tailor communication strategy for different groups. still maintaining, the consistency of the message and the scientific validity of it, but also making sure that the message about urgency and the relevance of the issue and of the threat is communicated and it's kept in a delicate balance. But discussing also about successes, I think that I've been with React for 3 years, but I can also, I think, speak for my other colleagues, which have been there for 19 years, that there has been several significant successes. But something that we've been working over the years is definitely empowering local communities and stakeholders, including also patients. We've been providing tools and resources that could be adapted to also different cultural contexts, because that, of course, varies quite a lot, while also enabling those specific voices to take lead and making a decision in the different regions. And one of those projects, and that I can perhaps speak about a little bit, and maybe if there is more time afterwards, I can also deep dive into. It's indeed what you mentioned, the From People to Leaders campaign and call for action. So back in April, we launched a call for action with 10 asks for policymakers, and those asks were being collected from communities, people working with communities and civil societies all around the world. And I'm proud to say that by now we have over 550 signatures on the call for action. It's still open, and I can perhaps share it also in the chat for sign-ons. And of those 550 signatures, which are from over 80 countries in the world, it's the first time. Over 140 are communities and civil societies coming together and standing behind the call for action. I'll stop here, and perhaps if there is time, I can deep dive into the call for action. But I also just want to mention that we're going to have a side event, and I'm pre-announcing it here for the first time today on the 24th of September during the UN General Assembly, where we're going to gather indeed communities and civil societies, and the event is organized by a core group of them. But you will receive more information shortly. I'll stop there. Thanks, Francesca.
Yeah, thank you, Andrea, and please do share the call to action in the chat so that attendees can visit the page and sign on. So I'm gonna move back to Europe, and I'm gonna ask Danilo if he can tell us more about the work that WHO is doing in Europe, and in particular with stakeholder engagements and with AMR awareness raising at the European level.
Well, thank you very much. And first of all, also acknowledging the previous speakers and specifically Pernilla also for sharing her story, and thanking the organizers for letting me be here. As you may know, WHO in general and also Europe in specifically has been focused on antimicrobial resistance for a very, very long time, from the very, very technical level to the more practical level. And although mainly in the day-to-day, I guess our first audience would be ministries of health and supporting them in their work, we also do very much recognize the very key role that stakeholders and community engagement is providing. And this is through occasions like this, we really are very happy to engage. Specifically with this in mind, and stakeholder involvement and community involvement, we had this in mind when we developed our new AMR roadmap for the WHO European region. We had extensive consultation also with civil society and others. Just sort of to highlight that we have 4 key principles of this roadmap. The one is looking at health through a One Health lens. The second one is taking a people-centered approach. So trying to go away from this fixation on bug-drug combinations, but really thinking of what does it matter? It actually affects people and animals, of course. Having a strong view on equity and also have a more holistic systems view. Within the roadmap, and I cannot go into too many details, but we have different action areas. And one of the action areas is community awareness and enabling behaviors, which is very much specifically on this topic. And also we have enabling areas to help implement these action areas, and one of which is a very strong focus on health workforce. On the more practical side of things, we've developed some tools and materials that can be used by organizations or by communities or others that want to implement within the community. Just to name a few examples, we've developed these posters 2 posters for doctors to have in their room as a reminder of, you know, in some cases you do not need antibiotics, and also how to communicate that to patients. And at the same time, we've also developed posters for the, let's say, the waiting room, where patients can learn a little bit about antibiotics and be prepared for the fact that they may not get it and they may not need it. And in relation to that, we also developed this antibiotic-free prescription, which is basically like a leaflet or a prescription that guides the discussion between the doctor and the patient, and they sort of develop the treatment, or maybe not a treatment, but going through the symptoms, what is needed, what is not needed, what can they do, etc. So it's to help the patient leave the consultation feeling that they've been taken seriously. They come home with something tangible. They come home with good advice, which not necessarily may be an antibiotic prescription. Then on the general practitioner side, we've also developed training courses, competency-based training courses for antimicrobial stewardship, which also includes a lot of the interaction with patients and sort of the co-creation of a treatment plan. And I guess the most well-known is, of course, the World AMR Awareness Week, which happens every week, but 1 week in November, which is really important, and it's really taken off as a global movement thing. But I really need to stress that it doesn't belong to WHO, does not belong to the quadripartite. It belongs to all of us. And at the same time, of course, realizing that 1 week of a lot of attention is not enough. We need to continue to have community engagement. And in this, we also started our Stories of AMR campaign, where each week we post a story of, could be a patient, could be a doctor, but quite often it's also any other member from society. Could be a restaurant owner, could be a lawyer, could be a school teacher, etc., from all of the countries in our region. And we also are taking this collection of stories in a book to the UN General Assembly a couple of weeks from now, to bring the voice and the faces of AMR to that very special and very important event. And finally, also, we have a lot of efforts in behavioral insights, and we do projects in countries to go beyond awareness and actually try and understand behavior. And once you understand it, we can tweak it in the right direction. So I'll leave it at that. Thank you very much.
Thank you, Danilo. So we discussed about some practical examples, and I'm going to move to Laura and Anna, because they're working on a specific work package about AMR, raising AMR awareness at the European level, European projects for EU GMRI. And so I'm interested to understand the objectives of these activities, but also, are you creating any, developing any specific tools that are useful then to patients and the general, could be useful to patients and the general public?
Hello everyone. Well, first of all, thank you so much for giving us the opportunity to be here. And a special thank you to Pernilla. I cannot imagine the courage that it takes to revive such a painful story and turn all that energy into positive action. So thank you so much for that. I really think that it makes a difference in policy making, and probably all the meetings should start with a personal story to remember and remind all of us that this is a real personal thing for the, you know, the survivors and unfortunately those ones who cannot survive. So going back to, you know, to the technical level of EU GMRI, it's important to remind that we are not starting from scratch, because EU GMRI had a first edition that ran from 2017 to 2021. We developed campaigns, we developed a game app to support teachers treat the AMR subject in schools. We also produced a behavior change communication toolkit for countries and stakeholders so they could develop their own strategies. We also developed some policy briefs, and probably, you know, the most, you know, the activity with most impact was the AMR symbol that you can see here. We called individuals from all over the world to action, organizing a design contest to find the first symbol to represent the AMR challenge. from 600 entries from 44 countries. The winner was the design of David Lunder, a Swedish product designer. I don't know why Swedes always win these kind of things in the design field. Well, and his design, you know, was very powerful, a very simple shape, but very powerful. Is two hearts slide together, taking, you know, the shape of two capsules. And the hearts, you know, tell us that we need to care. The capsules set the theme. And the band-aids shape, two band-aids, also remind us that there's something that we need to fix. So we are hoping to consolidate this symbol during EU Jambright 2. EU Jambright has just started, and we will give continuity to this effort. But this second edition is much more ambitious. We have many more partners, 120 from 30 countries and 12 times the budget comparing to the first edition. So now our challenge is to surpass the past achievements and do it better. And you know, we will try to empower individuals and empower patients to make informed decisions. That it's very important, and encouraging a shift in behaviors towards responsible antibiotic use and also prevention. So Anna will provide more details about the different activities that we have planned for EU Jambright 2, but I would like to highlight that one first commitment is to base our communication efforts on positive concepts. We want to avoid warlike language to refer to the work that we do. We often use to combat, to fight, to defeat. And we feel that, you know, and also all the studies that, you know, study how to promote behavior change, support that it works better when we communicate positively. So we would prefer to use to build. And from this commitment comes our slogan, that it's building a One Health world to reduce antimicrobial resistance. Anna, if you want to build on that.
Yes, thank you, Laura. We would like to convey to society ideas such as together we are stronger, we are on time, or prevention is in the hands of each and every one of us, messages encouraging action. During these 4 years of this joint action, we have many online and offline actions planned. In the educational field, we will promote an online and live escape room, a debate kit for school children, and also an online library on AMR for university students. For the general public, based on scientific publications on communication and art, we are designing campaigns that link both concepts. We will give visibility to patients' stories, as human interest stories make ideas and messages more tangible for viewers, readers, and listeners. Whenever possible, we will showcase these stories and encourage patients to become ambassadors for the AMR symbol. And additionally, we will develop materials tailored to other key target audiences, including healthcare professionals, farmers, veterinarians, and environmental experts. And to achieve this, we will rely on a European network of communicators that we are currently developing. And this network will help us to understand local needs and cultural particularities, allowing us to create campaigns that are tailored to each country.
Thank you so much, Laura and Anna. So we are running out of time. I had more questions, but unfortunately we don't have so many minutes left. But I have a pressing question, which I think it's kind of important, because the work of the AMR narrative and as well the EPF is about involving patients in the AMR discourse. And so I'd just like to ask each of the panelists to give a word of advice, keep it very brief, but I just would like to get from you advice for patients or patient groups that want to become more involved in the AMR debate. What should they do? And I'm going to start with James.
Thanks so much, Francesca. Look, I think that it's critically important to mobilize at global level, regional level, national level, have like a shared set of advocacy priorities, and to make sure that donors and technical agencies are providing resources, whether it's technical, whether it be financial, to build that capacity and really implement those that advocacy plans to raise those voices. Because as everyone has sort of said, and we completely agree from Stop TB side, having the voices of people affected right at the center, at the front of the response is a very compelling argument to sort of engage new members, but it's also critically important from a human rights perspective to ensure that the promotion and protection and of the participation of those most affected is at the heart of this discussion as well. Thank you.
Thank you, James. Andrea?
Yes, thanks, Francesca. I also agree with what James just said. And I think in general, it's also very important that we create a collective movement. And that's what we've been trying to do, really coming together, whether it's behind a set of us or whether it's behind a story like Pernilla told us today. I think that's extremely important. In our specific case, as a React, we have, as I mentioned before, offices in different regions. So I really encourage everyone to get in contact with the different regions of React, and we're happy to just collectively really try to solve the issues. And also, if we think that definitely like alone we can go perhaps faster, but together we can definitely go further away. So I'll stop there. Thank you, Francesca.
Thank you. Danilo?
Yeah, I think very similar to what Andrea and James just mentioned. I think for us, we're always happy to get in touch with organizations, national or international. I think this is a great example on how we can, bring you in and amplify messages either broader geographically or up politically. I was going to mention that we have a strategic partnership group here, which holds these briefings for non-state actors, which include civil society and NGOs. It includes collaborating centers, youth alliances, and other UN agencies. So we have the tools of bringing people together and sort of amplifying messages. So be very happy to work with you, both in this region, but also globally, of course.
Thank you. Laura?
Hi, well, as our colleagues, I will encourage them to speak up and get in contact with us. But not only through institutions or charities or projects who work to raise awareness about AMR, but also within their families, co-workers, neighbors. We don't ever say our neighbor died of AMR, but we do say our neighbor died of cancer or other diseases. It's still a very blurred thing that people don't know. So the more patients speak up and share their stories, I know that it takes a lot of courage. We need to put them forward, patients forward, to raise awareness.
Anna?
Yeah, I would say that they are the best ambassadors to convey the message that we are all part of the solution. And while individual actions may seem insignificant, like drops in the ocean, these drops can create a ripple effect. So please speak up, like Laura and all the panelists have said.
Thank you. Thank you so much to all the panelists for joining us, or giving us some of your time, and for sharing their amazing work that you're doing on a daily basis to, again, stop the spread of AMR. Thank you so much again to all of you, and I'll pass it to Vanessa to conclude the webinar.
Yeah, thank you so much, Francesca. And that was, I sat here listening to everybody's perspectives, and I was, it was so informative. And again, thank you so much to Pernilla for setting the tone, because your story was, kind of what we do in terms of the AMR narrative and the European Patients Forum. We're focusing on patients in the public and how our voices can make change. So, and I heard that reiterated with, between all the panelists, like, what are we trying to say? We've got the statistics, we're trying to build the statistics, we're trying to research, we're trying to figure out exactly what AMR means to people on the ground, the end users of antimicrobials. Yeah, I just want to say thank you to everybody for being there. And I'm not quite sure if everybody's, sorry, I'm getting a screen on my screen at the moment.
No worries, Vanessa. We can hear you. I think
Okay,
we
good.
can just mention the next webinar actually, which is planned on the 12th of September. To really, it will be the last one of our series and for the run-up of the UN meeting. So we look forward to having you there. Please do not hesitate to register, and you can contact us. We have our contact details on the screen. Thank you so much. To everyone who attended today, thank you so much to our panelists for the incredible discussion today, and we look forward to the last one and the next one. But of course, that's not the end of this initiative.
Great. Thank you very much for everybody for joining, and we'll see you again on the 12th of September. Thank you.
Thank you.
Thank you.